Dr. Arshad Abbasi, who's an orthodontist, she says that his wife is undergoing the 4th pregnancy, and all earlier 3 pregnancies she had GD, that gestational diabetes, also known as gestational diabetes mellitus, GDM. And now gynecologist has told her that she should not have any further pregnancies, so what should we do? What are the options? Gestational diabetes or gestational diabetes mellitus is when a lady normally doesn't have diabetes. But when she undergoes pregnancy, during the middle of pregnancy, her sugar level rises. She has diabetes. And that's the difference between the 24th and 28th weeks of pregnancy. And this thing happens because there are certain hormones that are released by the placenta. And this hormone, it suppresses the insulin, which cannot be absorbed by the cell. It starts accumulating in the body. That's how the sugar level rises. And this is called as gestational diabetes mellitus. Regarding a question that your wife is undergoing the 4th pregnancy, and the earlier 3 pregnancies she had this GDM, the gynecologist has advised her that she should not have one more pregnancy. It may be detrimental to her health. What should we do? What are the options? In such cases, it is preferable that if you can take an advice of a Muslim doctor who has more knowledge of the deen and the science. For example, we are aware that multiple cesarean section is not good for the lady, and if she has 3 or 4, then the next cesarean section may be detrimental to her health. And a similar case like GD, she already had 3 pregnancies. In all these 3 pregnancies, sugar level went high during pregnancy, and now the gynecologist has advised that she should not have more children. What should you do? According to the scholars and the fuqaha, they say in such cases, you should take advice from minimum 3 specialists. My advice would be that if you can take an opinion of a well-known gynecologist who's a Muslim, who's aware of the Quran and Sharia, it's preferable. If not, also, no problem. What you have to do, that take opinion of 3 specialists. So go and show your wife to 3 gynecologists who are specialized in this field of GDM and ask the opinion. If all 3 of them say that having one more pregnancy would be detrimental to her health and it's very dangerous, there are high chances she'll die, then you have to avoid the next pregnancy. But if they say, okay, no, she can have, maybe the chances is only 5 or 10%, she can yet have another 2-3 babies, depending upon the opinion. Only taking one opinion and taking a decision is not right. Take the opinion of 3 doctors, and if all 3 say there is very high chances, maybe more than 80%, 90%, she may die, then it's something to be concerned. But if they say, okay, there's a risk, maybe only 5%, 10%, and there are ways that, if she undergoes a pregnancy, the chances are less, it's not that detrimental. And if something happens, the worst case scenario, maybe you'll have to abort the child. Normally, in Islam, aborting the child, especially after 120 days, is haram. Before that, for medical reasons, etc., is permitted. Generally, it's not permitted. Abortion is haram in all cases. But if there are medical reasons, and if you do it before 120 days, it's permitted. But after 120 days, it's not permitted except if the life of the mother is in danger. For example, she has had GD or multiple cesarean. Some ladies can have 3 multiple cesarean, there's no problem. Some can have 4, some can have 5, some can have 6, depending upon various factors. Depends upon various factors, the health of the mother, the size of the opening of the mother, the health of the various factors are there. So based on that, it differs from different people. Same thing with GD. Health of the mother, what's the level. So when you take the opinion of 3 different specialists and what they say, if it is really very, very, very detrimental, that, all 3 say that no, if you have one more child, there are high chances, very high chances that she will not survive, then you have to see to it that you should take precaution that there is no further pregnancy. But if they say no, yet she can have maybe 1 child, 2 child, 3 child, she'll have to take a little bit care, she'll have to have less sugar, or nothing will happen. And in worst case scenario, we may have to abort the child, which is permitted in Islam to save the life of the mother. Then I feel that you can go ahead with another pregnancy, but taking advice of 3 different specialists is better. And depending upon what advice they give, we have to take the next step. Hope that answers the question.